I'm Alicia Martin, and I'm a student nurse here at the University of South Alabama, and today I'll be performing a medication administration checkoff. So first I want to make sure that I'm in a non-distractive environment. I'm going to make sure I don't answer any phone calls, make sure that I limit any conversation with my colleagues to only essential information. I'm also going to make sure the door to the medication room is closed, and I want to make sure I abide by the hospital policy regarding a non-interruption zone. So first what I'm going to do is compare my MAR to my patient care order form. So starting off, we have Jaguar J. Jones. We have medication record number, the 4176352, 4176352. Allergies to penicillin, and the medicine we're giving today will be heparin. So we have heparin here, 5,000 units, subcutaneously, every 12 hours. So both the patient care order form and the MAR both add up. So I'm going to do away with this. Okay, so now what I'm going to do is perform hand wash, and I'm going to complete my first check of medication administration. Well, my first check of the 7 rights. So starting off, we have heparin. So I'm going to grab heparin from the medicine cabinet. And here we have heparin, 10,000 units per milliliter. And the expiration date is 12/5/2025, so it is still up to date. Next, we have 5,000 units, and our heparin has 10,000 units. So I would give out, if it's 10,000 units per milliliter, I would pull back 5,000 units per half milliliter, and I would make sure that I verify this dosage calculation with another nurse. We also still do have the same patient, which is Jaguar J. Jones. Medical record number 4176352, and the allergies are still penicillin. Next, subcutaneous. Our route is subcutaneous, so we have a 1 milliliter tuberculin safety syringe, which is a good syringe for subcutaneous injection. Every 12 hours, the patient has not had the medicine in the last 12 hours. Heparin is an anticoagulant, meaning it reduces blood clots, and all of the documentation of legal prescription are included. Okay, so next I'm going to draw the medicine in the syringe. So still having my heparin, 10,000 units per 1 milliliter. That means we're ordered to draw 5,000 units, so I'm going to draw back half a milliliter because it is 10,000 units per 1 milliliter. And I, of course, will verify this with another nurse. So I'm going to open my heparin. I'm going to get an alcohol pad and wipe the top of the vial. And then I'm going to grab my syringe and open the package. Still using my subcutaneous syringe. Okay, so I'm now going to open. I'm going to lift up the vial. I'm going to inject iron flip. And I'm going to draw back half a milliliter of heparin. I'm just going to pull this off. I'm going to do the scoop method. Okay, so I did draw back half a milliliter of heparin. So I'm going to sit this down, and I'm now going to perform a second check of the 7 rights. So starting off, we still have the same patient, Jaguar J. Jones, medical record number 4176352, and allergies to penicillin. We still have heparin, and we have heparin here. This is our vial. 10,000 units per 1 milliliter. We are ordered 5,000 units, so we have drawn back into our syringe 5,000 units, also known as 0.5 milliliters, and of course, I've already verified this with another nurse. Subcutaneous is our route, and we still have the same subcutaneous syringe. This is our 1 milliliter tuberculin safety syringe. Every 12 hours, the patient has not had it in the last 12 hours, so we're going to give it to them now. Heparin is an anticoagulant, meaning it reduces blood clots, and also all of the documentation of legal prescription are included. Okay, so now I'm going to create a label for my syringe. Write in Jaguar J. Jones, heparin, 5,000 units per half a milliliter. We can do medical record number 417 6352 and allergy penicillin. Kind of bled through, so I'm gonna rewrite it. Okay, so I'm gonna put this on my syringe. All right, so just to do another check before I head to the patient's room. So we still have our heparin vial, 10,000 units per milliliter, and we have our syringe with 5,000 units per half a milliliter. We still have Jaguar J. Jones, medical record number 4176352, 4176352, allergies penicillin, and subcutaneously, we still have our subcutaneous syringe every 12 hours. They have not had it in the last 12 hours, and we still have our heparin, which is an anticoagulant which reduces blood clots. So all of the documents of legal prescription are included. Now I'm going to gather my supplies and head to the patient's room. Okay, so hello, Mr. Jones. I'm Alicia Martin today, and today I will be injecting heparin into your system. Is that okay? You say yes. So first, I would lift the bed up, and I'm going to lower the side rails. I'm going to perform hand wash, and I'm going to perform my third check of the 7 right. So starting off, we have Jaguar J. Jones. We have Jaguar J. Jones on our syringe, and we also have Jaguar J. Jones on our mark. Medical record number 4176352. Medical record number 4176352. Medical record number 4176352. Allergies to penicillin. We still have heparin. We have our heparin vial here, along with our heparin, which is labeled on our syringe. 5,000 units. We have 5,000 units per half a milliliter. 10,000 units per 1 milliliter on our vial. But we performed and got the correct dosage calculation, which correlated to 5,000 units, which is also equal to 0.5 milliliters. Subcutaneously, we still have our same subcutaneous tuberculin safety syringe. Every 12 hours, Mr. Jones has not had it in the last 12 hours. And we still have heparin, which is, Mr. Jones' heparin is a anticoagulant that reduces blood clots. Is that okay? Yes, and all of the documents of legal prescription are included. Okay, so my bed's already raised, my side roll's already down. I'm going to perform hand wash again. I would pre-assess my patient for anything that seems abnormal or normal regarding the medication that we're about to administer. I would then choose an injection site. With this being subcutaneous, I'm going to go for the abdominal injection site. I want to make sure I stay below costal margins and above the pubic area. I want to make sure I stay in my anterior superior iliac spine region. And I'm also going to make sure I stay 1 to 2 inches out from the umbilicus in a U shape. I am also, when I choose an injection site, I'm going to make sure there is no edema, inflammation, or redness. Okay. So I'm going to explain the procedure to Mr. Jones, and I'm going to position him for comfort. excuse me, I'm going to position here for comfort. I'm going to hand wash again. So now I'm going to put on my goggles and my gloves. I'm going to do one final check before I actually insert. So on my syringe, you have Jaguar J. Jones, along with the armband, Jaguar J. Jones, medical record number 4176352, medical record 4176352, medical record 4176352. We have heparin in our syringe, heparin on the MAR, 5,000 units. We have 5,000 units on the syringe. Subcutaneously, we have a subcutaneous syringe. Every 12 hours, he has not had it in the last 12 hours. And we still have heparin, which is a anticoagulant, which reduces blood clots. And all the documents of legal prescription are included. So now what I'm going to do, since this is subcutaneous, I am going to take an alcohol pad. I've chose my injection site. I'm going to clean in to outer. And then going to pinch the skin. I gotta let go of the skin first. I'm going to open my syringe. I'm then going to pinch the skin. And with it being subcutaneous, I'm going at a 90-degree angle. 1, 2, 3. I'm going to inject. Dispose of my syringe in a sharps container. I'm going to apply pressure to the wound, making sure, well, not the wound, but to the injection site, making sure I don't massage it. I would then assess for any immediate allergic reaction. I'm going to remove my gloves. Remove my goggles. I'm going to continue to assess the patient. I would see how he took the medicine. I'm going to let the bed down and raise the arm rails with the side rails back up. I'm going to perform hand wash again. I'm going to let the patient know that I am going to the nurse's station to document what I've just performed, and that I will be back in 15 minutes to check how he handled the medicine. And this concludes my medication administration checkup.